You don't want to give them in levels of a person that is in their 50s and 60s, because this is what happens. If you look at tests, they compare tests to what's called the population. The average North American person is an unhealthy person. So if you're normal in the ranges, you're as normal as the average unhealthy person. That's not a very good normal. You get the idea? You don't want to be that. You want to be compared to the healthiest individual, especially with hormones. So when a doctor says you're within normal ranges, that means normal, unhealthy, normal ranges. Always get compared. So when we do hormone tests, we're comparing it to the healthiest, most optimal. And that's the word we want to use. Not high, optimal levels between a 25 to 35-year-old. And it's monitored by regular saliva, serum, or urine tests. Just to give you an idea, saliva measures what your tissue uses, what your body uses. Serum measures what's in the blood, the reservoir. And you don't use it in the reservoir. So blood is good for diagnosing a disease, but it's not good for diagnosing function. And that's two kinds of tests. There's tests that measure how healthy you are, and there's tests that measure how sick you are. And there's also tests that measure how you start the process. So what you want to do in this clinic, we're measuring how healthy you are. I don't go after how sick you are anymore. I just go after the deficiencies, because my job is really easy. I'm like a big gas station. I test a bunch of things. Whatever's low, I fill, and I stand back. Because whatever the body needs, you give it. You don't argue with it. Just give it what it needs, and it does what it's supposed to do. That's the balance. You don't just give it one thing. Laboratory assessment, I'm not going to go too much in there, but that's what I mentioned. There's a difference between standard tests that measure the tip of the iceberg and things called functional tests, which measure the big picture. In functional medicine, anti-aging medicine, orthomolecular medicine, we're using functional tests. Now, I'm not getting you to write this all down, but this is a standard of what somebody would come in, and this is most people get this panel when I'm doing it, if they want to be thorough. I'm using human growth hormone. I'm measuring a binding protein, testosterone, dihydroxytestosterone. If you're male, I'm measuring PSA and prostate, estrogen levels, DHA levels, something called sex hormone binding, which is actually a truck that carries around the hormones, fasting insulin, cortisol levels, thyroid, lots of thyroid tests. I measure actually 6 tests for thyroid. In the standard current medical system, they're only measuring one, called TSH. Homocysteine, which is a measure of inflammation, C-reactive protein, and H1AC. This is a fairly standard plan for most patients walking in. Some are more extensive. Now, mental emotional. Gonna be okay? You guys are doing amazing. I'm talking fast. I'm like, yeah, so suffering in silence. Oh, I love this stuff. Suffering in silence. Increase women's risk of death by 4 times. So if you were in a relationship and you did not talk or fight with your husband or fight with your spouse, you had a 4 times risk or 400% risk of dying from a heart attack. So if you are going home tonight, you have my permission to fight with your spouse and say, I'm not doing this for me. I'm doing this because my doctor told me I was going to do it. If I didn't yell at you, I'd die. So women who avoided conflict. Happy women equals happy hearts. A 10-year Swedish study of 600 women between the ages of 30 to 65, stressful marriages increase the narrowing of blood vessels. What did I talk about? You actually close down the vessels, increase blood pressure, increase stroke, increase heart attack. I don't know if you needed a study to prove that, but it was good that we had it. This is a little slide expressing how we're all born. I believe, and I've seen to be true, that we're all born pure in some way. Okay? I don't know if we're all born perfect, but we're all born pure. So born pure. And somewhere down the line between ages 6 to 12, I've noticed a pattern where we have some hurt that happens to us. And that hurt that happens to us ends up giving us some fears, which are not necessarily the fears of excitement where we're all open. These are the fears that actually keep us from doing things. And then we create some walls, some protections, and overall, that ends up being our life. And these things seem very subtle for a lot of people, because a lot of us are doing something so reflexively out of reflex that we don't always notice it. But what these end up doing is they will keep us from being happy, they'll keep us from loving somebody, they'll keep us from accepting wealth into our life, they'll keep us from our friends, our fitness, and our family. And they're very subtle, because a protection is exactly that. It protects you from what it perceives will hurt you again. So the way we think affects the way we feel. If you haven't figured out, even though I've talked about a lot of physiological things here and a lot of dietary things, you can't escape the fact that a lot of studies are coming out and showing that the way you think affects the way you feel. And we're seeing some nice physiological links to this. Hypothalamus, remember I talked about that. And our reactions. So the way we think Our hypothalamus, our boss, affects our adrenal glands, which you saw on the last slide. It also gives more inflammation, which I talked about the dinosaur story. Now that means something. That means, yes, the way we're thinking, if we're taking in the thought, even if it's a past thought, even if it's a memory of a hurt, we're causing more inflammatory responses. So we know now for sure this exists. So it's important that whenever you're going through any kind of health program, you make sure that you're putting yourself in a state of peace as many times as you can. There's no such thing as absolute peace, or not that I know of anyway. We have a little bit of conflict. We have a little bit, and it's okay as long as we try to figure out, limit as much as we can, get into a state of peace as fast as possible. So what we talked about overall, all of our body ages. There's no pause in menopause or andropause. There's no such thing. Just a name. You're always as young as your oldest part. Fast aging is a balance between damage and repair. It's preventable and treatable. Poor diet, toxin exposure, and stress accelerates your aging, your suffering, and your disease. And healthy aging is an optimal balance between all of those. Okay, so here's that person. Their genetics, 20-30%. No exercise or too much. Dehydration, deficiencies, allergy reactions, stress and cortisol, sugar and coffee, toxin exposure, low hormones. Maybe they're 30 years old, they got a little damage. They only feel it now with a little fatigue. Now a couple more years go by, maybe now they got some more symptoms, they go into their doctor. They're not sick enough yet, so they're walked away saying you're healthy, it's normal for your age to feel lousy. Okay, they get more inflammation, more damage. Now they're in their 40s and 50s, maybe they get a little bit more, now they get a heart attack. What a surprise. That's how it works. Bing, bing, bing. That's the universal sign for not good, by the way.